state of full physical, mental and social well-being is referred to as being in good health. Being disease-free is only one aspect of being fit. The term disease refers to a state of abnormal bodily functioning brought on by an infection, a poor diet, hereditary factors, environmental factors or an undernourished brain. Microorganisms or microbes can also be the reason for a variety of diseases in humans, and in recent times, infections caused by viruses, fungi, etc. have exponentially increased. From the recent outbreak of the Marburg virus to Candida auris, an emerging fungus which presents a serious global health threat, we bring to you some of the emerging microbial infections in this video. Keep watching. Marburg virus. Marburg virus disease or MVD is a rare but severe hemorrhagic fever which affects both people and non-human primates. MVD is caused by the Marburg virus, a genetically unique zoonotic RNA virus. Just a handful of outbreaks have been reported since the virus was identified in 1967. But a steady uptick in occurrences in Africa in recent years is raising alarm. Marburg causes high fever, vomiting, diarrhea and in the most severe cases, bleeding from orifices. It spreads between people via direct contact with the blood or other bodily fluids of infected people and with surfaces and materials such as clothing contaminated with these fluids. The average MVD case fatality rate is around 50%. Case fatality rates have varied from 24% to 88% in past outbreaks depending on virus strain and case management. Early supportive care with rehydration and symptomatic treatment improve survival. Fruit bats are considered to be natural hosts of Marburg virus. The virus is transmitted to people from fruit bats and spreads among humans through human-to-human transmission. One of the two outbreaks in Tanzania in East Africa seems to have been brought under control with just 2 people left in quarantine. But in the other, in Equatorial Guinea, on the west coast, spread of the virus is ongoing and the World Health Organization said last week that the country was not being transparent in reporting cases. The US Center for Disease Control and Prevention or CDC has issued a warning for travelers to the countries where the Marburg virus is spreading. Zombie virus. A team of researchers from Europe recently revived 13 zombie viruses or pathogens from Russia's Siberian permafrost. These bunch of ancient viruses were preserved in the cold grasp of the Siberian permafrost for tens of thousands of years, and some worry that this could have disastrous ramifications. Out of the 13 primitive viruses that these researchers found, the oldest was an amoeba virus found in stoic dormancy under a lake for 48,500 years. Using live single-cell amoeba cultures, the team determined that all 13 viruses still had the potential to become infectious pathogens. The oldest of these zombie viruses has been identified as Pandora virus Yedoma, which has set a record age for a frozen virus capable of returning to a state of infecting other organisms. It is believed to be 48,500 years old. This Pandora virus breaks the previous record held by a 30,000-year-old virus that was uncovered by the same team in 2013. Scientists have long warned that the thawing of permafrost due to atmospheric warming will worsen climate change by freeing previously trapped greenhouse gases like methane. This means that there is a possibility that such dormant microorganisms might wake up from their slumber and get released in the atmosphere. Since their refuge, the permafrost, would be gone. And precisely because of this reason, scientists warn that many viruses might be potentially revived and released into the atmosphere, which could then infect other species. This might turn into a public health concern later on. Plant fungus. Silver leaf disease is a curse for a variety of botanicals from pears to roses to rhododendron. Infecting their leaves and branches, the fungus can be fatal for the plant if not quickly treated. Aside from the risk of losing occasional rose bush, the fungal disease has never been considered a problem for humans until now. In what researchers suggest is the first reported case of its kind, a 61-year-old Indian mycologist contracted a rather serious case of silver leaf disease in his own throat, providing a rare example of a pathogen seemingly making an enormous leap across entire kingdoms in the tree of life. Fungal diseases aren't exactly uncommon in humans. Though of the millions of known species, only a few hundred are capable of causing us much harm. Ringworm, athlete's foot and thrush commonly make themselves at home in damp areas of our skin, much of our irritation. Sometimes, especially in people with compromised immune systems, fungi can commonly feed on rotting vegetation such as species of Aspergillus, can infect deeper part of our body. This particular infection didn't look much like any of those. However, prompting the medical specialists to seek advice from a World Health Organization Fungi Reference and Research Center who identified the unlikely suspect from its DNA. Candida auris. Candida auris is an emerging fungus that presents a serious global health threat. CDC is concerned about Candida auris for three main reasons. It is often multi-drug resistance, meaning that it is resistant to multiple antifungal drugs commonly used to treat Candida infections. Some strains are resistant to all three available classes of antifungals. It is difficult to identify with standard laboratory methods and it can be misidentified in labs without specific technology. Misidentification may lead to inappropriate management, and for this reason, it is important to quickly identify Candida auris in a hospitalized patient so that healthcare facilities can take special precautions to stop its spread. The drug-resistant fungus was only discovered some 15 years ago but is already one of the world's most feared hospital microbes. It gets inside the body. The yeast-type fungus can affect the bloodstream, the nervous system, and several internal organs. The World Health Organization estimates that its mortality rate ranges from 30% to 53% of patients affected by an invasive infection. Tick virus. The tick-borne encephalitis virus or TBEV has been found in Britain and the authorities have warned hikers and mountain bikers to protect themselves. TBE is already common in many parts of Europe and is an important cause of viral infections in the central nervous system, according to the World Health Organization. It can cause a range of illnesses, from completely asymptomatic infection to mild flu-like illness to severe infection in the central nervous system, such as meningitis or encephalitis. Tick-borne encephalitis or TBE is spread by tick bites. Fever, headaches, muscle pain, and fatigue are just a few possible symptoms. Neurological signs like disorientation, agitation, seizures, and paralysis can occasionally manifest. While the risk to the general public is low, the UKHSA has recommended changes to testing in hospitals to ensure cases are detected early, particularly given its asymptomatic presentation in some people. Mucormicosis or black fungus. After the first phase of COVID-19, the second wave affected a lot of Indians with a mysterious fungal infection known as mucormicosis. Mucormicosis is also termed as black fungus due to the necrosis of affected tissue of the patient's skin which turns it into black. These molds live throughout the environment. Mucormicosis mainly affects people who have health problems or take medicines that lower the body's ability to fight germs and sickness. It most commonly affects the sinuses or the lungs after inhaling fungal spores from the air. It can also occur on the skin after a cut, burn, or other type of skin injury. The infection can also spread to other parts of your body through your blood. This is called disseminated mucormicosis. When this happens, the fungus can affect organs like your spleen and heart. In severe cases, you have changes to your mental state or go to coma. It can be even deadly. This was all for today's video. Hope you liked it. Please subscribe to our channel In Depth for more such content. Thank you for watching.